welcome to the Fit and Healthy Today show. And today our topic matter is bladder infection, also aka cystitis. There's upper and lower infections, and the one we're going to talk about today are going to be the lower, which are going to be the bladder and the urethra types of infections that we most encounter. When they get to the kidneys, which is the upper, that's when it tends to be a little bit more severe. So today we're just addressing the bladder and urethra infections. 11 million doctor visits in the United States per year, 90% of them being from women for bladder infections. Now, typically, lately, physicians have been recommending a very, very high potent antibiotic called Cipro. And that Cipro just destroys everything in its path to kill off the what's potentially E. coli bacteria 90% of the time, and therefore leaving women vulnerable for about a 50% return rate to the doctor within about a 6-month period of time for another bladder infection. So the JAMA and other alternative practitioners have suggested, and the research supports, some alternative treatments should be attempted first before using these very strong antibiotics. In the old days, we used to use a Bactrim-based sulfa type of drug, which was not as difficult on the body, but this heavy dose of Cipro, which they use for anthrax and things that are very difficult to fight off, is typically what they're now prescribing for bladder infections. And like I said, it just kills all your good bacteria in the bowel and leaves you with tons of potential for having additional amounts of infection. So we're going to talk about the symptoms, the causes, the diet that can be helpful when you have the infection and preventative, as well as some of the treatments when you have the infection and things to do to prevent it. Symptoms: pain and burning upon urination, or you feel like you've just got that continual desire to go every hour on the hour. Now, if it's accompanied with blood, then it could become more severe, or be more severe potentially if you've got a little bit of backache to it. But if it's just that, urge to go, the cramping a little bit, that's typical symptoms of a bladder or urethra infection. The causes. Now, they're numerous. Most bladder infections are due to the E. coli bacteria, which is a pretty virulent bacteria, but it's easily lodged out of the bladder with diet and supplementation. About 10% of them, more or less, we can also have staph, but that's rare, are also fungal infections of bladder. People who eat a lot of sugar, and antibiotics or antimicrobial types of antibiotics that they recommend don't work on those types of fungal infections, whereas natural treatments will. Vaginal or intestinal bacteria, then the frequent use of antibiotics, as we noted on here, 50% return rate within 6 months after you use antibiotics for a bladder infection. Stress makes you very acidic, brings down the immune system. Sex. Pregnancy and hormonal changes. Menopausal or perimenopausal women are much more likely to have bladder infections or urinary tract infections than with their counterparts who are not or who do not have PMS or issues. Poor diet or food allergies, especially a C-deficient diet, or chronic inflammatory issues having to do with allergies. Certain allergy medications can make the resistance, especially the steroidals, the resistance go down in the body, lending itself to more bladder and chronic bladder infections. And then, of course, we've got structural abnormality where the body just doesn't empty the bladder very well. So it's real important that you do your best when you sit and use the restroom to empty the bladder. And if you choose, you can kind of do the little bit of the Kegel exercises or the stopping of the movement to strengthen the tissues of the bladder as well. But oftentimes, too, with chronic infection, you'll end up with scar tissue in the bladder, and that can lend itself to more infections as well, too. Certain usages of diaphragms for contraception, because you're introducing something into the vaginal area, and right there next to it obviously is going to be your way to eliminate your urine. So that can introduce the E. coli bacteria as well too. When we talk about diet and the things when you do get the infection, I know this is hard, but if you can drink a 6 to 8 ounce glass of water every hour that you have during the day, waking hour of the infection, that can really help to get everything kind of flushed out. And then if we add things such as unsweetened cranberry juice. Now, when I say unsweetened, you could add maybe a little bit of apple to it, but we're not going to do the one with high fructose corn syrup that you get in that little concentrate out of your local grocery store freezer. It needs to be real cranberry juice, not cranberry juice with high fructose corn syrup. Avoid all sugars, refined carbohydrates, particularly soda. Sugar feeds the bacteria, and it will grow very, very, very fast if you give it its fuel source, which is going to be sugar. So, in addition to absolving or getting rid of all sugar and carbohydrates, refined carbohydrates out of your diet, we want to avoid spicy, salty types of, well, in other words, kind of avoid junk food. Because once again, the junk food makes you very acidic, it lowers the immune system, which allows the E. coli to grow, and it feeds it as well. The things that tend to make the bladder flush really well, and they can be antimicrobial, besides cranberry, are watermelon, celery, parsley, and then of course garlic is an antimicrobial. I mean, if you're going to sit there and down, and I sometimes, if I feel it coming on, I'll do more celery juice, or I'll cut open a melon, start eating the melon. Parsley, juniper, those types of things get your bladder to move more, to flush. That's the whole point behind drinking the water. I know most people say, oh my God, you're going to have me drink more water during a bladder infection. I'm going to be going every half hour instead of every hour. But we got to try and flush it out as much as we possibly can. And the usage, and you can even use your dash of cranberry juice at the time, mixing it with the water and dilute it, and just do it in every hour as well too. And oftentimes, that can flush it out of the system. See, cranberry doesn't allow the E. coli bacteria to stick to the walls of the bladder lining, so it'll flush it through. So if it hasn't become too entrenched and we catch it early enough, it can flush it through and get it out of the body. I'm going to talk a little bit first about prevention, and then I'm going to address the supplements. Now, obviously we mentioned always empty the bladder, and please try not do like I do and wait until it's the last second before you can barely make it to the restroom as your bladder is overexpanded and full. Very hard on the bladder, and it can get your bladder muscles kind of crampy and all. In addition, it can get you to where you don't eliminate your bladder fully as well too. So try to go, hopefully when your bladder is about 3/4 of the way full instead of overexpounded. Empty the bladder after sex, and even some of the research I was reading also involved drinking a glass of water after sex, because you're going to flush it out, especially if you're perimenopausal and menopausal. The potential for flushing out E. coli bacteria is much greater if you do that. Immediately change out of swimwear. Don't sit around in a wet bathing suit, sitting there, on the sand and the beach and everything else. When you're there, boy, make sure when you can, before you leave there, take off the bathing suit and change into your underwear, dry underwear and shorts, because that moisture holds in the potential for bacteria in combination with the dirt. And I'll be doggone, we can not only introduce E. coli, but we can also introduce a staph infection, which is much more severe and more difficult to get rid of. Wear cotton underwear whenever you can, because they breathe. Obviously, breathing materials don't hold bacteria. It allows the air to flow through. So wear cotton underwear, particularly if you're fighting an infection or have a propensity towards infection. Always wipe when you go potty from the front to the back. So no wiping from the front. And we oftentimes have to teach our little girls to do this, because they'll end up with chronic bladder infections when they're little, and then scar tissue as they grow older. So always wipe from the back to the front to try and keep the E. coli from the feces, because remember, E. coli is the main bacteria found in the feces, so we don't want fecal material around our urethra opening in order to enter into our urethra tract and our bladder, giving us the infection. Avoid scented tampons or sanitary napkins, because they can also irritate the area. Tight clothing you know, especially some of these genes that will cut up in that area, can irritate and lend itself, and when that urethra area gets irritated, it can make it have a greater propensity for an infection as well. So try to wear things that are a little bit free moving, not tight and pulling up on there with no flexibility or that are immobile, which primarily are really extremely tight genes. When we look at supplements, I had already mentioned cranberry, but there are some real good studies from the Journal of American Medical Association that basically says that 400 to 500 milligrams of cranberry extract 3 times a day when you have an infection can fight it off pretty quickly if you catch it early, and 2 times a day if you do it as a preventative. I always do my cranberry at this type of dosage every day, and I don't have issues as a result of that. So anybody who's had chronic bladder infections should consider doing the cranberry. A good multiple vitamin, in order, especially one that's high in B's and has a little bit of extra C, and substituting additional amounts of C help too. But that helps tissue repair. So if you're B deficient and mineral deficient and you don't have adequate amounts of nutrients, the tissue can't repair itself and the immune system can't engage when you are fighting off these types of bacteria or funguses. Colloidal silver. I've read a lot of research about combining colloidal silver with cranberry to kill off infections, and it basically involves a good quality micronized colloidal silver on an empty stomach in combination with cranberry 3 times a day in a couple ounces of water, and it usually, because it's an antimicrobial, will kill off the infection about 95% of the time. So if you can catch it early and do it, and mind you now, JAMA is recommending we try some of these other sources before we try the antibiotics because the recidivity rate is so high, the repeat rate is so high. Garlic is also something very antimicrobial and can kill off infections, and I mentioned it in the food section earlier. But when you can deal with anything that's antimicrobial, now garlic and colloidal silver, oregano oil as well too, are antibacterial, but they're also antifungal. So since, and I always think everybody should always go to the doctor if you can, if it doesn't go away in a couple of days, to get tested and make sure that you're actually dealing with a bladder infection and what kind of infection you're dealing with. D-mannose. Now this works like a Swiffer. If you've seen that commercial where the dirt is lying on, it just kind of adheres to the Swiffer. Well, what D-mannose does, and we use this a lot for people who have chronic kidney infections as well, or in one case I have one little baby that's awaiting kidney surgery, and they were going to put the baby on antibiotics until she turned age 2, and that's just a naughty no-no for potential hearing loss and lots of other things. So we've been using D-mannose and under the doctor's supervision, and baby's not ended up with any bacterial infections at all. I know we have a couple of local doctors in town that recommend this for prevention, and then also can be used in conjunction with some of the other things for if you do get a bladder infection. Uva ursi. This is an herb that's been used for centuries, multiple centuries, and what it does is the extract of it converts into a chemical that actually destroys bacteria. Now, uva ursi also helps kind of flush the kidneys, so a 250 milligram extract can be helpful. Probiotics, especially if you're doing antibiotics, but anytime you're working on trying to kill off an infection, it's always good to give your body more good bacteria in order to fight infection. And the probiotics, also known aka as the good bacteria, help give your body a fighting chance to support keeping the infection away, just not killing off the infection. Ester C also inhibits the growth of the E. coli bacteria and prevents scar tissue, and it's good for treatment as well as prevention. Marshmallow root, corn silk tea, these all can soothe the tract. Oftentimes you'll be given this very heavy kind of drug that stops some of the spasms and cramping, and if we can just do a little bit of magnesium and a little bit of marshmallow or corn silk tea, it can calm that down. Now there's also homeopathy or homeopathic medicines that people can take that can ease the symptoms, some of the pain and other things that accompany bladder infections, and can help the bladder empty out a little bit better. That could be helpful as well. In a nutshell, there's alternatives, and oftentimes one of the very few exceptions being recommended by some of the major medical groups or Journal of American Medical Association, the American Medical Association, recommending these alternative types of things. Take a peek at them. You can give them a shot. If you need more information, you can ask your healthcare practitioner. Most doctors, however, do not know about these alternatives, so you may have to research some of it on your own. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the fitness portion of our show. I meant to say fitness on the last segment, not research. That'll be coming up. I'm going to show you an exercise that could help improve your brain energy and wake you up a little bit during the day if you're feeling a little bit tired. And this was shown to me by a Ayurvedic practitioner, Christine, on an exercise that I could use during the day when I have a lot of stress and I'm trying to calm my mind but give myself a little bit of energy as well. And what it involves is the usage of your nostrils and your fingers, and not going in but on the side. First of all, you inhale with your left nostril, and you inhale so that your stomach expands or abdomen expands, and then you switch sides and you exhale through your right nostril, and you want to get all the air out, and then re-inhale with your right nostril again, and then switch and exhale through your left nostril. What you're doing is you're kind of doing a horseshoe event, so your left nostril inhaling, right nostril exhaling, right nostril inhaling, left nostril exhaling. It's like a horseshoe. And when you do that, it can help calm the mind and bring you back more into focus during the day, especially if you're having a real high stress day. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano.
Thank you for that intro. And the first lead off as far as a trivia question, what popular beverage can raise your risk of pancreatitis by up to 52% just from your very first time you drink it? Well, that'll go towards the end. After that, let's look at zinc. Zinc has been re-examined again, especially in the lozenges. I know we get a lot of conflicting reports in regards to zinc, so they wanted to clear it up once and for all. And this was published in the Open Respiratory Medicine Journal. What they discovered was this, that zinc lozenges above 75 milligrams per day, again, zinc lozenges at 75 milligrams a day, decreased what they call the common cold episodes by up to 40%. At minimum, do all those studies they looked at 23%. Now, the reason for the conflicting studies is because when they use zinc lozenges below the 75 milligram dosage level, they found out they didn't have virtually any benefit whatsoever. So there was a benefit threshold at 75 milligrams is when the benefit for zinc lozenges begin to kick in, which is interesting because zinc lozenges were originally discovered in the 1980s when a little girl who had leukemia started sucking on the lozenges, or not lozenges at the time, tablets, instead of swallowing them. At that time, the doctors recognized her immune system just kicked in and cold duration was immediately reduced down to virtually nothing after a day or two, which surprised the doctors. So when it comes to zinc, don't go overboard. You can take too much, and it can make you a little nauseous if you do. And usually between 75 milligrams and 100 milligrams max per day total in your lozenges. And again, it says up to 40%. It's a published study, so keep that in mind. So that should end part of the argument in regards to zinc lozenges. Now, the argument in regards to high fructose corn syrup and sugar. Is there a difference? Well, we all know that the American Dietary Council allows for 25% of your calories to come from sugar in your typical American diet. The American Heart Association is against that, would like to see about 5%. But what they decided to do is see what happens when people take 25% of their calories from high fructose corn syrup and sugar, or glucose they would say. They discovered, and this was published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism, the JCEM. They found adults who consumed high fructose corn syrup for just 2 weeks, at the recommended allowable level of calories per day, 25% of their calories coming from high fructose corn syrup, raised all their blood levels of cholesterol and triglycerides just in 2 weeks. Now here's the amazing difference. Normally you expect it with sugar, and sugar doesn't mean it's healthy. But after 2 weeks, the glucose did not result in a raise in cholesterol nor triglycerides. So there is a difference in the body somewhere. So if you're concerned about cholesterol, you're concerned about triglycerides, and you want to lower it pretty fast, stay away from that high fructose corn syrup. Bad stuff. There is a difference, regardless of what the stupid, misleading commercials imply. And now to ADD. Now this study in regards to ADD was published in The Mind and Brain, the Journal of Psychiatry, Volume 2, Number 1. And again, so it was a published, double-blind, crossover placebo study. And what it involved is something called transcendental meditation. Not in regards to any religion or religious philosophy, just a focusing tool. And they discovered some pretty interesting things, especially when it came to ADHD, that blew the researchers away on top of that. They took kids and looked at 3 months of kids practicing transcendental meditation. They noticed they had a 50% reduction in stress, anxiety, and the ADHD symptoms. This is not with medication. This is just a simple focusing tool that happens to go by the name transcendental meditation. Then they did another study, and they conducted the study over 6 months of independent school children for language-based learning disabilities in Washington, D.C. The study showed basically they had improved brain functioning, increased brain processing, improved language skills, and again, all among the students only that were practicing transcendental meditation. And then it gets even better. All right. They said the transcendental meditation technique that they utilized did not require any concentration, controlling the mind, or disciplined focus, which is usually found challenging for any kids with ADHD. The fact that all the children were able to do transcendental meditation and do it easily showed that this technique may be particularly well suited for children with ADHD. A couple other things they discovered in the study, besides the fact that transcendental meditation worked very well. They also noticed that the kids were also happier after completing about 3 to 6 months of transcendental meditation, at least 2 times per day, over about 3 to 6 months. The combined results were significant. There was also a 48% reduction in what's called theta to beta power ratios, which is something they use to measure ADHD, and a 30% increase in brain coherence after the 6-month period, which ironically, the pharmaceuticals only improved what's called the theta to beta power ratios by 3%, meaning only improving them by the ADHD symptoms by 3% and the neurofeedback by only 25%, which TM, or transcendental meditation, seems to win. They also pointed out between 1991 and basically today, they have seen a 2,000% increase in ADHD prescriptions. Over 9 years, basically, they said 2,000%. Almost all the medications prescribed to kids with ADHD, especially for insomnia and mood disturbances, are not approved by the FDA for use in children. Almost none of them. They also said the ADHD medications their side effects are not fully known, but evidence now suggests risk of cardiac disorders, sudden liver damage, and psychiatric events. It's also found that children on ADHD medications are found to have long-term medication has significantly higher rates of delinquency, substance use, and stunted growth. And this is the interesting part, the kicker, on people with ADHD drugs. We found that stimulant medication did not significantly improve children's levels of depression, self-perception, or social functioning, and they were more likely to be performing, this is their words, performing below their age level at school by a factor of 10.5 times. So if you want something effective, as obscure as it sounds, research transcendental meditation for kids with ADHD. It's going to get them ahead in society. The medications is just going to fulfill someone else's bank account or mutual fund. All right, now the antidepressants. Another problem, and this is disturbing too. This was done by the Johns Hopkins Bloomberg School of Public Health and published in the August 2011 Health Affairs. They discovered that about 80% of all prescriptions for antidepressants have absolutely no psychiatric evaluation with them. They're just done off the cuff. No psychiatric follow-up, no psychology follow-up, no nothing. So 4 out of 5, or 80%, basically have no medical reasons for these antidepressants to be prescribed, at least not prescribed by a psychiatrist. They said, to the extent that antidepressants are being described for uses not supported by clinical evidence, such as fibromyalgia, chronic fatigue, sleep disorders, addiction disorders, you name it, all the way down the line. They're just being half-heartedly thrown at you. And the reason that's kind of important follows us into the next story. Antidepressants increase the risk of the elderly dying. But guess what? They looked at elderly, at 60,746 people in the United Kingdom over the age of 65 that were given SSRIs. It increased the risk, this is only after the 1 year, it increased the risk of anybody over the age of 65 of dying of all causes, any causes, all cases of mortality, by 7%. And of course, that includes suicide, self-harm, heart attack, strokes, falls, fractures, epilepsy, seizures, and even high salt levels in the blood. All reasons for dying. So here you are, you can prescribe the medication without a psychiatric diagnosis, and to top it all off, it's more likely to wipe you out in about a year or so. And now, basically back to the original question in regards to what will give you an opportunity to have pancreatitis from the very first drink by up to 52%. Now, this is European, so it's done in centiliters. They discovered that hard liquor or spirits, not beer, not wine, increased your risk of having a pancreatic attack from 1 serving, 10%, to about 5 servings, 5 servings, up to 52%. Didn't matter if you drank or not drank. Didn't matter if you drank the entire year or this is the first time you're drinking. It didn't make a difference if you were a drinker or not. From the very first time to any time, it increased your risk of having pancreatitis from anywhere from 10% to 52% the number of the drinks. And that was it, and thank you very much.
Thank you very much, Ralph. Thank you again for joining our show. Once again, research, lots of good information here. Thank you very much.